Well, we know the trends are moving in the wrong direction right now with coronavirus. When you look at the cases, when you look at the hospitalizations and the deaths in our state, what concerns you the most right now?
You know, I think what concerns me the most is the big change we've seen in the last several weeks. And unlike the spring, it's our rural counties that are really leading this, unfortunately. If you look at Fayette County, for example, or Ross County, these counties have tremendous amount of community spread throughout the county. And that just means that, you know, there's so many people out there who are carrying it. And even though sometimes they don't know they're carrying it. So that's what we're really seeing. We're seeing certainly a increase in hospitalization. You know, we're not through a crisis yet as far as hospitalizations, but we're seeing those numbers go up. And unlike the summer, when it was mostly young people that were getting infected, now we're seeing older people get infected. So that does not bode well as far as hospitalization and ICU, and in some cases death.
We also know that when it comes to mental health, when it comes to addiction, we're seeing those trends moving in the wrong direction as well. How do you factor those health issues into this moment as well?
Well, people are hurting, and it's not just the virus itself. People are hurting from a mental health point of view, from the isolation. We know that mental health problems are significantly up. You know, we're working with the local NMH boards and others to, you know, try to help in that area. But I think the most important thing we can do is try to keep a positive attitude about this. You know, we're going to announce this week the preliminary steps to set up the vaccination when it comes. We're getting ready for that. So help is on the way. We're going to have a vaccination. We don't know what date that's going to come or exactly when, but it's going to come. And when we start vaccinating people, you know, it will take a few months. But once we get out to a very significant number of people, we know that we're going to start, you know, reaching this herd immunity, or this, what I like to refer to as community immunity, and that's going to come from the vaccinations. But we got to get through the next few months, and the next few months could be very tough. So, you know, we got to keep our eye on the ball. The community spread that we're seeing is not coming so much from people working, nor from students going to class, or even college students. It's coming primarily from outside the classroom. It's coming from outside the workplace. And it's really people just letting their guard down. It's very easy to do. We all do it when we're around family or friends. We let our guard down. So it's these parties that are occurring, informal gatherings, it's weddings, sometimes even funerals where people are just getting together. And you know, our message is you can do that. And we want to go about our life. We don't want to shut our economy down. Again, we want people to be able to live their lives. But we have to just do it carefully. And so, you know, we can do everything or most everything that we've always done. We just have to do it more carefully.
Since there are so many variables that we don't really understand yet when it comes to the vaccine, how do you prepare to roll that out? What are you doing right now? What can we expect to hear this week?
Well, we're going to announce tomorrow a portal where people will go up online, or companies will go online. Basically, our hospitals, doctors will go online, you know, to be able to take that vaccine when it gets here. So, you know, we're laying the foundation. We know it's coming, and we're getting ready to do that. But, you know, you mentioned we don't know a lot of things, but we know a lot more today than we knew when this virus hit in the early spring. And you know, one of the things that we've learned, reach over here, one of the things we've learned is these masks are really very important. We didn't really know that at the beginning, but the evidence clearly shows that when you've got two people who are both wearing a mask, it cuts down the odds dramatically that even if one person has the virus, that they're going to get it from the other person. So this is so very, very important. And I know people are sick of wearing masks. They're sick of keeping some social distance. But the end is in sight. We're going to get there, but we got to get through the next few months. And we get through the next few months by wearing masks, keeping distance, and just being careful what we do.
The restaurant industry in particular, is crying out for change right now. What markers are you looking for in order to allow restaurants and bars the opportunity to serve alcohol past 10 p.m.?
We know when we came up with the 10 o'clock time, that was really a compromise. The White House, Trump administration was telling us at the time, you need to shut the bars down completely. We came up with a compromise, and that is let's let them continue until 10 o'clock. Now I realize that this is really hitting bars hard, it's hitting restaurants hard. 2.5 weeks ago, 3 weeks ago, frankly, we thought we were on the verge of being able to lift that because our positivity rate was going down. Our cases were down below 1,000 a day. Today we've got cases over 2,000 a day. Our positivity rate has almost doubled in that period of time. So that's been the problem. So, you know, when we get these numbers down, we'll be able to open that up. But most everything is really open today. You know, you can't get a drink or you can't order a drink after 10 o'clock at a bar, but you know, most everything else is open. We're going to have an announcement, I hope, in the next several days to give some financial assistance. It's not going to be huge, but some financial assistance to those who have liquor permits in the state of Ohio, to give them a little bit of help, because we know that this has been a very tough time.
How does personal autonomy factor into your decisions with this virus? Because we know we shouldn't smoke, but people do. Health experts say we should get flu shots. People don't. How do you factor in personal choice when you are framing the guidance for Ohio?
Well, personal choice, you know, freedom is very important. And I look at these masks, frankly, as giving me, my family, other people in Ohio, my fellow Ohioans, the freedom to do things. You know, we don't want to shut this community down, the society down, business down. We want people to go about their business. We want to keep our schools open. We want to keep our colleges open. We want to keep our businesses open. To do that, this is the way we do it. So, you know, it is a question of personal freedom. I think freedom comes during the time of COVID from this mask, quite frankly. And I know that many people say, look, this is my personal choice. The only thing that I would say is we know that there are a lot of people out there who have the virus and don't have any symptoms. So you could be carrying it and you don't know you're carrying it. We've seen real tragedies where younger people who've had the virus didn't know they had it. They infected a grandparent, infected someone older, someone who had a medical problem, and that person ended up in the hospital and in some cases ended up dying. So the personal choices we make in this case directly impact our family, directly impacts anybody that we might come in contact with out in the public. So it's a little different than if it didn't have any impact on anyone else.
One final question for you. How is the search going for a new health director?
Well, we're still working. We think we have a good person lined up. We're also looking for a chief medical officer. But I don't want anyone to think that we don't have good experts available. We reach out to Ohio State. We reach out to WSYX Medical Center, Cleveland Clinic, University Hospital, University of Cincinnati, and so we have a lot of good doctors who advise me virtually every single day. I was talking to some this weekend. And we also reach out, frankly, beyond Ohio to medical experts around the country. So we've got a very good team. They've worked exceedingly hard. And I also want to give a shout out to the local health departments, 113 local health departments in the state. They're overworked. They're doing a great job. And so thank you, each and every one of you, for what you do.
Governor DeWine, thank you for your time.
Good to be with you.